Many times they come nervous, and sort of seeing them through that and making them comfortable is very rewarding. And oftentimes seeing them go home with wonderful news is good, and having the best care that they could have possibly had here at Hopkins.
Patients choose Hopkins for IVF because they want to receive the finest care that they can be given in the world. We pride ourselves on serving patients, in particular, patients who have had trouble becoming pregnant, either because of their age, because they've failed to succeed at other centers, or have been turned away from other centers because it is thought that they would not be successful.
We have all kinds of protocols that we tailor to the patient response, and that makes a difference. And I think that in reproduction is a very physiological process that varies from patient to patient, and sometimes in the same patient it varies from month to month. And I think that's the key of the success.
We're fortunate at Hopkins. We have a lot of resources and excellent researchers around us in the university. So we developed some research program so that help us to understand the mechanism of implantation so that to improve the implantation and pregnancy outcome. We
have brand new facilities, state-of-the-art in terms of andrology and embryology laboratories, a procedure room. We do all of our monitoring, which means ultrasound monitoring, blood drawing, and the retrievals and the transfers in this beautiful location north of Baltimore City. We offer all the services that are available in assisted reproductive technologies, including regular IVF, including GIFT, donor sperm, donor oocytes, and pre-implantation genetic diagnosis.
Each IVF patient will be assigned someone that will be with them throughout the entirety of their time here, their visit, to make sure that it's not so overwhelming for them, that they have a seamless experience. We actually have about 75 international care coordinators, and they speak over 20 different languages. We help with transportation needs, accommodation needs, we help with processing medications, we help with the financial piece of their care, processing bills, understanding their bills. We also have, from a clinical perspective, dedicated nurses that actually help facilitate the clinical aspect of the patient's care while they're here.
We do our best to make sure that we're reducing their stress, that every step of the process is going well. And oftentimes we're calling home after they've left to hear good news, to hear about their families growing, and to check in with them.
What motivates us is to take couples who have had problems and having them participate in our program and seeing them succeed. That's our motivation.